We have everybody. It's not quite 9. I have still have 8:59, but if everybody's here, I'll ask. Good morning, everybody. Welcome to Groundhog Day. I'll ask Mr. Tipo to take the roll call, please.
Thank you, Warden. Councillor Arnold, please.
Present.
Thank you. Councillor Bird.
Present.
Thank you. Councillor Bouchy.
Here.
Thank you. Councillor Bradley. Councillor Bradley. Councillor Broad.
Present.
Thank you. Councillor Cook.
Present.
Thank you. Councillor Ferguson.
Present.
Thank you. Deputy Warden Hand.
Present.
Thank you. Councillor Loosley. Thank you. I see you there.
Present.
Thank you. Councillor Miller.
Present.
Thank you. Councillor Napper.
Present.
Thank you. Councillor Rumhouse.
Present.
Thank you. Councillor Stark.
Present.
Thank you. Councillor Bean.
Present.
Thank you. Councillor Weaver.
Present.
Thank you. Councillor White.
Present.
And Warden Marriott, we have a quorum.
Thank you very much. We acknowledge that this land on which we are gathered today is part of the ancestral land of the Chippewa, Ottawa, and the Potawatomi peoples, referred to collectively as the Anishinaabe. It is through the connection of the Anishinaabe with the spirit of the land, water, and air that we recognize their unique cultures, traditions, and values. Together as treaty people, we have a shared responsibility to act with respect for the environment that sustains all life, protecting the future for those generations to come. I'd ask if there are any disclosures of pecuniary interest at this time. Seeing none, I'd ask for a motion to go in camera, please. Moved by Councillor Broad, seconded by Deputy Warden Hand. All in favor? That's carried.
Just wait for her to give us the clearance.
Yeah. Well, welcome back, County Council, and this is the first actual council meeting of 2022. So welcome to the public that are watching as well. And Groundhog Day, I guess Oil Springs Harvey predicts that we have an early spring. So we have something to look forward to after today's 12 inches of snow that we might get. So I would ask Mr. Tifo to rise and report from in camera, please.
Yes, thank you, Warden Marriott. County Council met in camera briefly this morning between 9:01 a.m. and 9:03 a.m. to address two sets of minutes that were recording matters that were dealt with in camera previously. And those are the minutes of November 24th, 2021 of County Council and the minutes of January 19th, 2022 of Committee P.M. That's all I have to report.
Thank you, Mr. Tifo. I'll look for Dr. Renaday for his report. I'm sure he's logging on as we speak. There he is, right there. Good morning, Dr. Renaday.
Morning. Can you hear me?
Yeah, very good.
Okay.
Whenever you're ready.
Okay. Good morning, everyone. I'm going to pause my video or stop it just to preserve bandwidth. So hopefully you can still hear me throughout the update. There isn't very much that's different from the last time that I updated this group, but we'll structure it the way that we usually do. So in terms of cases, what we're seeing is a decline in laboratory confirmed cases, right? So the other day we had about 38 cases. That's substantially reduced from the days where we were getting 100 per day. It's important to remember that the cases are not as good of an indicator anymore of the population level prevalence or risk, right? Because a few things are happening. One is that there are fewer people who are eligible for testing for PCR testing. The second piece is that there are rapid tests out there that folks are using that are not reportable, right? So, and then the third thing is that there are probably many people who might have symptoms who just aren't getting tested. So when you take those three things into account, the cases that we are getting are a substantial underrepresentation of the cases in the community, right? So we have to look at some other kind of ways to figure out what's going on. So anecdotally, we're still seeing lots of reports of people home with symptoms. We are seeing Ontario Science modeling data that suggests that about 1 in 5 Ontarians, or around 1 in 5 Ontarians, might become infected, as well as polling data that talks about, that polls households to see if people in their families have had symptoms that are like COVID, that suggest that number is around 1 in 5, right? So that's just a bunch of different data points that you can use to try to figure out what's happening. Each of them on its own may be less informative than when you pull the picture together. So the picture together is the documented cases are falling, but those are an underrepresentation. So there is, still widespread prevalence of COVID in the community, but it's spreading the way, this Omicron variant spreads fairly quickly. It's fairly transmissible. And so it's making its way through the, population fairly quickly. That is likely to repeat, right? We're going to get ongoing waves of it, and our ability to detect those waves, again, will be limited over time because the testing parameters have changed substantially, right? But the other side of that is that even if you have a large number of cases in the community, now that we're talking about essentially a largely vaccinated community, we've also talked in the past about how the burden of that disease is going to change substantially, right? And we're already seeing that. So when we look at our long-term care and retirement home outbreaks, which, just last week we had up to 15 or 16 going on at a time. Now we're, I think, down to 5. So they go through quickly and they end fairly quickly. But the burden of disease has changed dramatically. And what I mean by that is with the sheer number of people who were infected in those outbreaks, we would have expected far more hospitalization and far greater mortality in a pre-vaccinated population. And now it's very, very different, right? And so although there have been fatal cases, those are much rarer, and in general, folks are experiencing much milder symptoms once they're in those outbreaks. And so that's reassuring. I think when you translate that to the wider population, you're still in the situation where if lots and lots of people are infected at a given time, even if the overall severity is lower, you're still going to see people who need either ICU care or ward-based care. And we're seeing both of those things happen with Omicron. But in general, the system is holding up. We see the surge has, it's either slowing down or it's abating. And also they're starting to recover different parts of their operations across the sector. So not just locally, but sort of in the province, right? So that's important, right? I think that we're facing a situation now where we're going to be dealing with ongoing waves and trying to incorporate that into the routine structure of how operations work, both in the healthcare sector as well as in other sectors as well, right? In terms of vaccines, that I would say, as we had discussed in the past, we ramped up our capacity substantially in January. We met a lot of demand that was coming through the door, and our clinics were fairly full through the end of January. And now in February, we are seeing a waning of demand. And so that has allowed us, in addition to some supply changes where we've gotten a little bit more supply, that has allowed us to open up the doors to the clinics to walk-ins. And so we've been able to do that for anyone who wants to do that as a consequence of the fact that we have waning demand and enough supply of vaccine. So that I anticipate will take the next couple of weeks for more people to filter through if they want a booster or even if they want first and second doses. But we're going to then try to plan the next several months of what that immunization program for COVID will look like, given that most people who will have wanted to be vaccinated will have done so. But that is ongoing, and I think we'll see we will continue that work, but again, the pace will slow a little bit in February in order to adjust to the demand. A couple of other things, treatments. So Paxlovid has been approved by Health Canada. That is an antiviral medication for outpatient treatment of mild to moderate COVID. It's really important to remember that because of the different interactions that medication could have with other medications that people are on. This is not the kind of thing that you're going to be able to just go to the pharmacy and pick up the way one might do so for a headache and pick up a pain medication. It really needs to be a situation where someone is assessed and then decided whether or not that treatment would be appropriate, and then it's offered to them. So there are mechanisms that are starting in different communities, larger communities mostly, right? Larger metropolitan areas to pilot this kind of program where Paxlovid would be made available through an assessment kind of model. And as that rolls out, I expect, as with that plus more supply, it will be rolled out to multiple communities. The other pieces around treatment are, of course, there's some other ongoing work to investigate different treatments, but that's the primary one that I wanted to let you know about. And also, there isn't a great supply of it now, and so I anticipate that the use will be the use or eligibility will be restricted to a certain degree. And then finally, in terms of the other kinds of public health measures around, that yesterday, I believe, was the day when a lot of things were able to start opening to 50% capacity. And then that's an ongoing discussion about how quickly and how broadly to change those restrictions. Different countries are approaching it in different ways. And so A, it's important to learn from them, but B, I think it's also important to say that we need to, as we start thinking about opening things up, we need to acknowledge that there will be cases and that managing cases and that managing waves is going to be part of our ongoing experience with COVID rather than an exceptional situation that we have to sort of put other things off for or hold everything off for. So in terms of the next few months, right, we've had 2 years of experience with this disease now. And when you look at the plots, you can start to see that there's a really clear seasonality to it. So we would expect that, the winter months are going to be more challenging, just as they are with flu and other respiratory viruses. But that as you move into warmer weather, warmer temperature, that you'll see your case numbers drop by virtue of more people doing things outside and less indoor congregation. That's part of it. But we are, because of how transmissible COVID is, going to continue to see waves of it. And we're going to have to adjust our approach to a long-term strategy. And you're hearing more of that reflected in comments by other jurisdictions, in positions by other elected representatives as well as medical officers. It's really a reflection of the increased transmissibility of Omicron and the effectiveness of vaccines that enables us to change our approach. So I think I'll leave it there. Hopefully that was a reasonable overview of what's been happening, and I'll turn back to you, Warden. Thank you.
Thank you, Dr. Renaday. Are there any questions? Councillor Burt.
Thank you, Warden Marriott. Through the chair to Dr. Renaday, thank you for your presentation. I've got 3 points to mention. So number one, we hear Dr. Kieran Moore announce that we have to learn to live with this virus. So what has been done locally to start that process?
So, Councillor, thanks for your question. I mean, I think that this is going to be an ongoing exploration of what does living with the virus mean, right? So if you'll recall back in December, I proposed something fairly similar to this audience and to others, right? And so I would say that it's only now that other folks are starting to reflect that message back as well. And so over time, what we're going to have to do is say, what does living with it mean? What are the additional precautions or interventions that we need to use on an ongoing basis, perhaps in certain high-risk situations? And what are the other strategies that we're going to use in terms of vaccination and other approaches? So I guess that, there's no clear answer to your question because nobody has really figured out what living with it means. But I would say that living with it means allowing most sectors to move on uninterrupted and focus interventions on areas where either the setting or the population might be at higher risk.
So thank you for that, Dr. Renaday. And just a second comment on that. So if we're going to move on and get on with our lives, does that also, part of this process, does it include lifting all the restrictions too?
I mean, I think that those things are hand in hand, right? So when you look at the approach of different jurisdictions, you see many, certainly some of the European countries saying we're going to start pulling back on a lot of the restrictions. And if we need to reimpose them because there's a new variant or there's something that really changes the situation, then we'll talk about it at that point, right? Other jurisdictions are still not quite ready to go there. And so you're seeing a dramatic kind of, I would say, a splitting of approaches among different jurisdictions. And so I talked a little bit a few weeks ago about how this process is going to be messy. And what you're seeing is the messiness of that process of understanding what does that look like and how do we accommodate different people's risk tolerances, recognizing that this is a long-term situation and not a month-to-month situation anymore.
Okay, thank you. And then question 2 is, I like to always keep up with reading and looking at all the stats on things around the globe, not just Canada, but what has happened with flu numbers this year? I haven't seen any published, so does this mean they're all being counted in as COVID? And if so, why?
No, it's unlikely that flu numbers would be counted as COVID. How we count flu numbers is similar to how we count COVID in that there has to be a laboratory confirmed report of flu that gets sent to us. So a couple of things are happening, right? The normal surveillance mechanisms for flu are probably not in place during COVID. That is to say that there was some ongoing surveillance that would be done in primary care and other places, and that really hasn't happened. And so you're not seeing as much reported because there's not as much testing. And then there's also the thinking that as you do interventions to reduce the overall burden of respiratory disease, that there is just less respiratory disease going around. So it's a bit of both things. There's probably a certain amount of just less flu because people are taking precautions that work for COVID and flu. And also a lot is to do with less testing because the usual systems that we use to identify flu are not really in place.
Okay, thank you. And just one final point, please, Dr. Renaday. So a few months ago, I had several constituents calling me really worried, people who, for whatever reason, whether they couldn't have the vaccination or didn't want to, whatever their reason, these were people that called me and said they had very young children and were really concerned going, if they had an emergency situation, as you often do with young children and babies, going into the hospital, would emergency still accept them here and carry out the emergency procedures, whatever was needed, if they were not vaccinated? So I followed up on that and I talked with the hospital team the head of administration and the spokesperson for the hospital. And I have emails that assured me that nobody will be refused in an emergency situation. And this was really important for these mothers to be assured. And we did that over and over. Absolutely nobody in an emergency situation would be refused treatment if they hadn't had the vaccination and wouldn't be questioned why they hadn't. However, the reason I bring this up is because just a couple of days ago, one such constituent had emergency surgery, and it wasn't planned. I mean, it really was emergency. They had an accident and they were taken straight to hospital. And in the, I guess while you're being prepped up for surgery and everything that's going on, it's a bit of a whirlwind when it's an emergency happening like that. And they've just told me, they're out of hospital, they've just told me that while they were getting prepped for surgery, the PCR test was carried out without asking them or anything. They didn't even know what was happening until they felt the stab. So I'm wondering why, on the one hand, they say they will accept people unvaccinated for these emergency situations, and now we have a case where this wasn't so. Do you have any comments on that, please?
So, Councillor, it's hard to comment on a healthcare delivery situation, especially one that I wasn't involved in. But from the circumstance that you describe, I think the two things are slightly separate issues. So the first issue is, will care be denied to somebody based on their vaccination status? And I think that will not be happening, right? I think that's fair to say. I think the other part, though, in terms of obtaining a test, that might be a result of hospital policies that are designed to understand whether or not someone presents a COVID risk when they're in the hospital. So the test is not about whether or not they're vaccinated. The test is about whether or not they have COVID. And if they do, then additional precautions would be applied to them during their stay in terms of infection prevention and control. So I think that's where that idea about doing the test comes from. But I don't think that it would alter the course of their treatment if there was an emergency treatment that was needed. So
thank you. But just one final comment on that then. Could you please let us know what you think, and I understand what you're saying. However, if the person coming in, other than the accident they've just been involved in, is healthy, they have no symptoms, they feel fine other than their accident, why not then do the rapid antigen test, which so many workers are having to do in the community right now? Why do the PCR test?
You know, Councillor, I'm not sure I could speak to that either. It might be because of access issues. So rapid antigen tests have been allocated to certain sectors for certain purposes, and the hospital has actually been allocated the ability to do PCR testing for their purposes, right? And so it might be just more about test availability than anything else. But there is, a rapid antigen test could be useful in that situation. But I think that the hospital is in the habit of doing PCR tests.
Okay, I'll follow this up outside of this, but thank you very much for your comments. I appreciate that.
Okay.
Councillor Stark, you had a question?
Thank you, Warden. Doctor, thanks for your presentation. I've received several questions in light of the reduced number of PCR tests and relative to people that are traveling abroad or certainly across the U.S. border and their attempt to re-enter Canada. The question is, do we have a test that can be purchased by the citizens that would show a history of whether or not you've had COVID? And the implications are that if you have had COVID in the last 6 months, in fact, you are allowed to enter without a test, an antigen test, to re-enter the country. Apparently, there's some form that the government can provide you that gives you a history of your individual exposure to, well, not exposure, but rather actual actually making sure that you've actually had COVID and therefore are excluded from the tests if it was in a 6-month period upon re-entry into the country. I wondered if you could comment as to whether or not there is a test that individuals can pay for that would allow that to happen.
So, Councillor, I think, let me just take that back to the idea of how do you know that somebody has had COVID? And there are really only a couple of ways. So the first is to have a PCR test done, or that's diagnosed and documented. The second is that you've done maybe a rapid antigen test, and the challenge with that is that that's never really documented anywhere, right? And so there's knowledge for your personal purposes, and then there's knowledge for demonstrative purposes to sort of say to someone else or to document with respect to something else that you've had COVID. So the rapid antigen test is not useful for documentation purposes, right? The PCR is, there's a lab report, it's a result that you can sort of track down in the system. And then I suppose the final one is a diagnosis that's been made by a healthcare provider that says that's then documented, right? The last part about whether or not you can get a test to prove whether you've had COVID, I mean, it sounds like you're referring to antibody tests, and so that's a blood test that can determine if you have antibodies to COVID. And the current my understanding of the current situation is that those tests have not been validated for use. So although they're able to be used in particular clinical circumstances that are very narrow, their use for the widespread population has not been validated. That is to say, nobody has done the work to understand how valid that result is, how reliable it is, or in what way it can be used. And so for now, apart from the other things that I mentioned, there is no ability to purchase a test to determine your history of COVID to decide whether you've had it or not.
Thank you.
Any other questions for the doctor this morning? Second call for last chance for questions. Councillor Rumboats.
Thank you, through you, Warden. Dr. Renedade, a while back, you had given us a report, it wasn't in public session, about the efficacy of the vaccines as far as transmission and giving it to other people. Can you go over that for us, just so the public knows what your position is on that?
Of course, yeah, Councillor. So let's go back to the 2-dose Delta days, and then I'll walk you forward to the 3-dose Omicron days. Okay, so in the 2-dose Delta days, there was early evidence that 2 doses of vaccine, especially against Delta, had good effectiveness in the short term at preventing symptomatic infection, although we didn't know how long that would last, and good effectiveness over a medium term at least of protecting you against severe hospitalization or death. When you move to the Omicron world, that definitely changed the game in terms of what the vaccine was able to do as a result of what the virus was doing. And so a couple of things happened. One, we found that even people who had 2 or 3 doses of COVID vaccine were still getting COVID-19 with Omicron, not with Delta so much, but with Omicron. And so as a result of that, it seems that the protection that you get from COVID vaccines against severe hospitalization and death is still persistent, which is good. That's really what we want. That's critical, right? And that seems to last for quite a long time. Although, again, we've only had 1 year of experience with this vaccine, so we have to see how long that protection lasts. In terms of the protection against symptomatic infection, it appears that when you get a booster dose, you get protection from symptomatic infection. It's not perfect, but it's pretty good for about 10 to 12 weeks. After that 10 to 12 weeks, we don't think that you have, reasonable protection against any infection, against any symptomatic infection with COVID, although you still have persistent protection against being hospitalized or dying.
Just to follow up on that, thank you. So we have a policy in place at the County of Lambton that anybody who is unvaccinated has to test before going to work on a regular basis and before being in a social situation to do with work. Does that still make sense, given that now people who are vaccinated can still get it and still transmit it?
Councillor, it's a good question. So what I would say is not specifically about the policy, but about the question behind it, which is, do we think that asymptomatic testing of unvaccinated people is currently a reasonable mechanism to prevent the difference in transmission between an unvaccinated person and a vaccinated person? And I don't think the evidence supports that at this time, right? So it really, what I'm saying is that a vaccinated person and an unvaccinated person seem, especially after the 10 weeks has passed, to be equally likely to be able to get COVID-19. It's unclear how likely they are to transmit it, but certainly, and why I say that is because if you're vaccinated, there's some thinking that you clear the virus more quickly from your system, so you may not be infectious for as long. Having said that, it's still possible to transmit that disease either from a vaccinated person or from an unvaccinated person to someone else. And so the thinking before with the testing of unvaccinated people was that if they were more likely to get the disease, that testing might catch that before they were able to bring it into the workplace. So that relies on two features. One is, what is the validity of asymptomatic testing, which I think is still an open question scientifically. And the second piece is it a reasonable measure then to be able to, early detect COVID? So what I would say is that the use of rapid tests now to detect COVID should now be considered independent of the vaccination status of the person.
Okay. Any further questions this morning? Seeing none, we'll let you go, Dr. Renade. Thank you again for your update, and we'll chat to you next time.
Okay, thank you.
Item number 8 is delegations. I'd look for a motion to allow the delegations this morning. That's Councillor White, seconded by Councillor Ferguson. All in favor? That's carried. The first delegation is Dr. Robert Dickieson and Jacob Pullen, who will be presenting to County Council regarding active transportation on county roads within the City of Sarnia. Dr. Dickieson, are you, there you are. You have 10 minutes.
Good morning, Warden, Merit, and councillors. So bear with me. I have set up my video, and while I'm doing this, I do a quick comment. Why I'm doing this video is because I have stage fright, believe it or not, and by doing these recorded videos, it calms me down a little bit, and I don't trip over my own words. So I really appreciate the option to send in these videos. Please let me know if the video doesn't work. I have it ready now, and your screen should change to me, and we'll play it now.
Good morning, Warden Merit and Lambton County Councilors. My name is Dr. Robert Dickieson, and I've been a resident of Sarnia since 2015. I proudly live in a historic heritage home on Vital Street near the downtown core of Sarnia. I've also lived in the north end of Sarnia and in Point Edward since my wife and I moved here from Prince Edward Island. During my 4 years in vet school, I lived on a 40-acre farm that was 15 minutes drive away from Charlottetown. It was owned by a couple that moved from Wyoming, Ontario to PEI. It's a small world, my friends. I'm also a proud father of a 4-year-old daughter and a 2-year-old son. I want the best for my children, which includes allowing them to grow up in a safe environment. Since my daughter has started going to school, I've tried to change my point of view to see the world through her eyes. In doing so, I must say that unfortunately, there are significant issues of pedestrian and cyclist safety in Sarnia and Lambton County. Over the past few years, I've been actively working with the City of Sarnia to resolve some of these issues locally. However, I want to speak to Lambton County Council to make you aware that some of these issues are present on county roads within the City of Sarnia. Compared to walking, bicycling, and taking public transit, there's one thing that a motor vehicle undoubtedly needs: space. It needs to be parked at home, at work, and in all the other places the motor vehicle owner takes the vehicle. Plus, once the motor vehicle is moving, it needs space on the road. When we shift from internal combustion engines to electric vehicles, we might fix some of the ongoing pollution issues. However, we should try to enable and empower citizens to choose active transportation over driving the car for their daily needs. And active transportation should mean prioritizing transport by ranking these from the most important to the least important. First pedestrian, second bicyclist, third public transit, and lastly motor vehicles. Again, In other words, walking, biking, taking the bus, and lastly driving. Of course, not everyone can walk, bike, and take the bus. Currently, the City of Sarnia is not designed to accommodate this, and Sarnia is especially lacking of bicycling infrastructure. Also, not everyone can bike or take the bus. However, many should be able when we create the right infrastructure to make an active offer for active transportation. This brings me to my ask to the county. Look at the map. You see that all county roads showed within the City of Sarnia are in bold blue. Take a look at these lines. You might notice that these roads form a great grid within the city. Some roads even are county-wide connector roads like London Road and Line and Lakeshore Road. These blue lines are defined as arterial roads. Traffic engineers speak of a dendritic system, which means that the smaller streets slowly get larger and larger and lead to larger and larger roads. These are like twigs and branches and trunks on a tree, hence the name. This focuses the traffic away from neighborhoods to a few roads like the county roads. Luckily, these arterial roads are not at capacity in Sarnia, and it should be possible to redistribute some of the asphalt away from motor vehicles to active transportation, walking and biking. After all, an arterial road for motor vehicles should also be inclusive and safe enough to allow walking and bicycling. You might wonder now, nobody bikes at say on London Road and Line right now. Well, so many do. I'm one of them. However, it's borderline stupid and dangerous to do so. I had many close encounters with motorists cutting me off when I was biking, law conforming, on London Road and other streets. This is the underlying issue. It does not feel safe to bike. It does not feel safe to walk. If it does not feel safe, then people will do it less and less, or not at all. Why bother, after all? This must change. In traffic engineering, there's a concept called induced demand. Essentially, the theory described a phenomenon that adding a lane for cars will temporarily improve the flow of traffic shortly after more cars will use that road. It induces the demand by increasing supply. This also works in reverse, reducing the demand by reducing the supply, concretely taking a driving lane away. Plus, it also works with active transportation. Make it safe, make it coherent, make trips pleasant and direct. Create a bike lane, create a safe boulevard with trees and good sidewalks. This will induce the demand and more people will walk and bike, especially when it feels safe. And to be clear, most roads in Sarnia are oversized. One of the most absurd examples is Indian Road north of the 402 highway or London Road west of Russell Street. Have a look at this picture. This road easily can be improved for active transportation and make it safer for everyone. Since the city of Sarnia is very compact and most trips within the city are within 5 kilometers. For example, I walk 25 minutes or bike 7 minutes to work in Point Edward. My wife bikes 10 minutes to her work. We walk our kids to school and daycare, a short 5 to 10 minute walk each. Bottom line, it should be possible to vastly improve the experience for people that walk, bike and take the bus to get around in Sarnia. Since the county owns critical grid of county roads within the city of Sarnia, the county should start thinking how these county roads can and should become part of the active transportation network in Sarnia. Improving active transportation could be considered one of the solutions to the comments made by the public on the last page of Appendix A of the Housing and Homeless Community Input Survey. One of the side effects with better biking and walking infrastructure in Sarnia and Lambton County will attract more and new people to the area, as the success of the Blue Water International Grand Fondo had shown. Thousands of road bicyclists come to Sarnia and area. This is great. As an advocate for safe and appealing active transportation infrastructure, I would like to submit the following request to Lambton County Council. That Lambton County commit to engage in collaborative partnership with the city of Sarnia and set an object of implementing or improving bicycle and pedestrian infrastructure, active transportation on county roads within the city of Sarnia. Please feel free to ask me any question. Thank you so much for your attention.
Okay.
All right. Hope this worked.
It did. Any questions from council? Councillor Bird.
Thank you, Warden Marriott. Through the chair to Mr. Dickieson, thank you for your presentation. Very interesting. And of course, if this was carried out, the positive aspects are, less pollution and an increase for safety and people's health because they're doing more physical things. And this is all good. The unfortunate thing that's happened in between, since I was a child growing up in England, where all villages or towns grew up as a nest or a hub around a certain item. So it could be a big company moves in and then they build houses and a school and a church all close together. So you have a community nest. That's how it used to be across all of Europe years ago. Now we have urban sprawl because everybody has a car, and because they all have a car and all drive a car, people either want to be lazy or get there fast. So things are spread out to incredible amounts. So how do we take back what has already been sprawled out over the urban areas to bring everything closer together so that it is possible to walk or bike or all the other suggestions that you brought forward, Mr. Dickieson? So I don't know what the answer is. I like your presentation. I like the suggestions. But how do we approach this with the urban sprawl that is present everywhere? Do you have any thoughts on that?
If I could speak to that, Councillor Bird. Thank you all for having us this morning. To what Councillor Bird said, we do need other options. It's great to help with pollution and other things that the community is facing right now. But cycling also needs to be promoted as a means of transportation as it was in Councillor Bird's time in England. It needs to be not only a means of leisure, but as I said, as a means of transportation for people who are being priced out of motor vehicles, whether that's the cost of fuel, whether that's the cost of the change to electric vehicles that are increasingly, that are becoming more expensive, including the infrastructure, and many people don't have a place to put the electric vehicle infrastructure. So there's a bunch of issues that come up with that. As Mr. Dickieson mentioned in the survey, people wanted different ways to get around their communities, different ways to complete their daily needs, whether that's getting groceries or anything like that. So that's something that we need to focus on. As per with what Councillor Bird's saying about the sprawl, that's another piece of the puzzle that needs to come into play. The land use zoning within the city. We need to focus on infill, but again, that's a different side of the story. But our main priority here today is allowing people to have different options to get where they need to go, whether that's including safe pedestrian or safe cycling infrastructure. People need to feel safe when they're biking. They're not going to bike on an arterial road with no protection from cars that are going 50, 60 kilometers an hour. The infrastructure needs to be separated, whether that's by grade or by physical barriers, so that people can feel safe, so that families can bike, so that women can bike, so that young children can bike to school. Along Indian Road, there are 4 schools. There's Rosedale, there's Arrow Road, there's Northern, and there's St. Thomas, which is a French Catholic school. This is a great corridor to have safe, separated biking infrastructure so that parents can feel safe sending their kids to school. Thank you.
Well, thank you very much, Mr. Pullen, for that response. And it's very, very interesting. And I agree with you. They are all separate issues. However, they've all got to be considered in the mix. So although we can't remove the urban sprawl that's already there, maybe part of this whole plan could be, as we go forward, any more food or general retailers that want to build, they should be encouraged to build in the nest. Let's start building up the nests that we have. So where we've got a housing estate, we should perhaps put some retail or food stores especially, because these are the stores that people go to every day, and we want them to be able to walk or go on their bike, not have to get the car out. So I think it's all part of a much bigger picture, but I like where you're starting, so thank you.
Councillor Rumboats and then Councillor Arnold.
Thank you, Ward and Marriott. I'm wondering if we consulted with London. I know they've made a real commitment to having an active city, and I've seen some of the changes that have happened in London. They went from having the green bike lanes that are within the traffic corridor to using a separate bike lane on a higher grade beside the sidewalks. So if they redo a sidewalk, they do a separate pavement, similar to what Plimpton, Wyoming has done from Wyoming to Reese's Corners. Like, that's a beautiful pathway there. So, like, rather than making the mistake of painting green lines and things like that on our existing highways, maybe we need to look at, when we're redoing a sidewalk, we do it right. Like, you do the sidewalk portion and then you do a separate area for bikes. It's just a suggestion. And I would like to comment that I know out in the rural community, the county just redid Egremont Road, and they've done it with wider shoulders, which makes it much safer for bikers, wider paved shoulders. So I would like to commend Jason Cole and his team for actively doing that. We have seen more bikers on Egremont Road as a result of that. It's much safer.
Okay. Councillor Arnold.
Thank you, Warden Marriott, members of County Council. Appreciate the presentation. And as many on council will remember, that the trail system was set up for bicycles a number of years ago by a committee of working in the county system. And so that's why the designated spots like Egremont that do have the wider shoulders, they were part of the trail system. St. Clair Township only has one road that's like that, and that's County Road 2. And I know we've asked for more bike lanes and that sort of thing. The city also has some designated ones in their area as well. What I would like to do, Mr. Warden, when the conversations are done here, that make a motion to refer this to the Infrastructure Committee for discussion and possible recommendations through staff and the committee coming back to County Council in the future time.
Thank you, Councillor Arnold. Councillor Bradley, you have a question.
Yeah, I'll second that. But I also want to make a point. About a decade ago, city and county both passed policies to do separations automatically on any new construction. I think that's been forgotten. And I think if Mr. Cole's on the call, a really good example, and we have examples on Michigan Road and on Wellington Road that resulted from those policies. But my recollection is the latest work on Lakeshore Road took into account that policy to put separation there. And that's a very long road and a very active road. So Mr. Cole, can you confirm that this is not something new to us, that we've been moving in that direction, and some other examples given for quite some time?
Through you, Mr. Warden, to Councillor Bradley, yeah, absolutely. The county is participating with local municipalities, not just the city, but all of our local municipalities, to look for and target active transportation initiatives. The paved shoulder widenings that have been mandated on the Lambton County Regional Trail Networks is a perfect example of that. And that's what you saw on Lakeshore. And in fact, since that policy was implemented, the county's constructed 270 kilometers of paved shoulders across the county. We went from a state with a very limited patchwork network to something which you see as being much more integrated and connected between our communities in rural Lambton County. We also recently worked with the city on Michigan Road, looking at a road diet option in that location. Certainly, we can't attack all locations at once. We look forward to working with the city as they update their active transportation master plan, which was we last worked with them on in 2014, which identified active transportation corridors throughout the cities where they made sense. And we want to work with our local municipalities to help accommodate off-road trails where that's something that they want to work with us on. Does that help answer that question?
Yeah, it does. And that's why I can support this motion going to infrastructure, so we can have another review discussion. But I wanted to make it clear, as most of you have indicated, you know that there's quite a bit of activity going on right now. So thanks for that.
Okay, so Councillor Arnold, did you want to repeat that motion, please?
Oh, there's a couple other folks that wanted to speak. Mr.
Warden. I'm sorry. Deputy Warden Hand. Go ahead, please.
Sorry, I just wanted to add to Jason's comments. When a when the county partnered with the city of Sarnia to implement the lane and the road diet on Michigan Ave, Point Edward got involved as well and carried that road diet into our village. So what we're all committed to as different municipalities is we don't have the money to attack every road at one time, but as roads come up for work, then certainly we're all considering, can we do a road diet? How can we implement adding a bike lane? And in Point Edward, our next activity we're looking at when we redo St. Clair Street is to add bike lane and do a road diet there. It also impacts on speeding and safety and whatnot, but we all are aware of the benefit of having the bike lanes. It's just a matter of how much it costs for the infrastructure changes, but it's happening piecemeal as we have opportunities. So I just wanted to add to that.
Thank you. Any other comments before we look at the motion? Councillor Weaver, please.
Yeah, I'd support the motion. I think that's great. We do have a policy at the county, and I would think that we treat all county roads in all municipalities similar and not have a special implementation or motion dealing with the city. I think our county policy looks after all municipalities the same, and so I support this coming back and getting a report on where we are and how we're going forward.
Thank you. Councillor Napper, please.
Thank you very much, Warden Marriott. Yeah, I would support the motion. I know they've had a lot of activity here in Pipton, Wyoming, and I don't know the number of kilometers, but I know the Lakeshore Road, there's been a lot of activity out there. And same as basically going from Wyoming to the 402, and they've done that. Even with the trail there, they put a bicycle lane in, which is, but I think it's going to take some education. I was on some roads where there was bike lanes, and some of the bikers were still maintained to be out in the what I call the car portion, when there was lots of room there. So it's going to take some education in both parts, but no, I certainly support it. And I didn't realize we had so many county roads in the city of Sarnia. That was interesting. For another day's conversation. But I would certainly support it. I think it's great.
Okay. Councillor Roundhouse.
Just to add to the conversation, I just wanted to highlight the fact that the widened shoulders are also economical in that we don't, from what I've been told, we don't have to replace the gravel on the gravel side of the shoulder as much. So there is a cost savings for those people who are not concerned about active living and are more concerned about the bottom line. The long-term savings is there as well.
Okay. Any other comments before Councillor Napper?
Yeah, thank you. I hate to keep butting in there, but isn't there already a policy in there? If any municipalities really feel strongly about this, don't we do it as we do the roads? But if they want to fast forward it, can't they contact Jason and maybe contribute to that? I think there's a policy in for that. I stand to be corrected, but.
Yeah, there is, Councillor Napper. So there is a question whether we need a separate motion, but if Councillor Arnold wants to go ahead with it anyway.
Thank you, Warden Marriott and members of County Council. The reason of the motion is so that we can review as well as look at whether we want to revise any policies in accordance to our trail system and also to adding more bike lanes here and there throughout the county. The policy and just a comment around the county roads in the city, that was under the old suburban road agreement with the county and the city prior to amalgamation. That's why there's so many county roads. Those are suburban roads that we always cost shared with years ago. But and then the trail system, when it came up, any of the trail roads that were designated are automatically expanded to have bike lanes on. So, and I think that's why I wanted to make a motion, Mr. Warden, to refer this to the infrastructure committee, have a report from staff in regards to this. Then between that conversation, we can make further recommendations possibly to county council. Okay. And that's my motion.
Thank you. And that was seconded by Councillor Bradley. Councillor Bird, do you have a question?
No, I was just...
Okay, Councillor Bradley.
The only suggestion I'd say to Mayor Arnold, should we not make it generic as was suggested to the whole county, which is really a ratification of what we're doing anyhow?
Well, I think that's why it's got to come back to Infrastructure Committee, Mayor Bradley, just to have those recommendations go out for the entire county.
Okay, that's fine. Thank you.
Okay. Any further discussion? All those in favor of the motion? Opposed? If any? That's carried. Thank you. Thank you for your presentation, Dr. Dickieson and Jacob. Second delegation is Judith Morris, CEO of Sarnia-Lambton Economic Partnership, and Katherine Walker, the chair of SLEP, will be speaking to County Council and providing an update regarding SLEP's activities and plans. Matthew Slatlinski is Senior Economic Development Officer, will also be providing support and answering any questions. So welcome, Judith and Katherine and Matthew.
Thank you. Katherine?
Thank you very much. Warden, county councilors, and guests, I am Katherine Walker, the chair of Sarnia-Lambton Economic Partnership. And on behalf of the board, I would like to thank you for this opportunity to provide you with an update on SLEP's activities. There's been a tremendous amount of work done over the past few years, both by the board and staff. There's also a great deal of uncertainty that the pandemic has created. But in spite of that, we are very excited about the accomplishments of SLEP to date and what the future holds with our economic development goals in Sarnia-Lambton. But we can't do it alone. Now more than ever, support for economic development is critical to the success of any community. To give you some insight into all the activity that goes on behind the scenes, I will turn it over to Judy Morris, who needs no introduction and for whom we feel extremely fortunate that she came out of her newly achieved but well-deserved retirement to step in as interim CEO. So I'll turn it over to Judy.
Thank you, Katherine. So kind of you. Thank you to the County Council for listening to our presentation today. I think you will be impressed. I want to start, first of all, with a video, because this video just depicts our beautiful county and the work that happens behind the scenes in terms of business development. So please roll the video.
Business opportunities that are here, I think, are actually just opening up. It's a great place to start a business.
Most people think that to be successful in tech, you need to be in a big city, somewhere in Silicon Valley or Toronto or Waterloo. But the truth is, if you're a tech company, you're running your business mostly online anyway. So you can be location independent, which makes a city like Sarnia make a lot of sense.
In Europe, they're actually starting to sort of copy what Sarnia-Lambton Industrial Alliance is doing, is getting their hubs of industry to work together.
We are in an agricultural heartland here in southwestern Ontario with significant amounts of available biomass and feedstocks. New companies are looking for brownfield lands where they can build their new plant. They're looking for facilities where they can get steam and power so that they don't have to build new facilities for themselves.
It is a beautiful place for people to come and develop their businesses and start their families. And so you see the presentation outline. We have lots to talk about, so we're going to move right into the next slide. And I want to be able to, I want to introduce you to our team. They are the keys to success. And so I want you to get to, if you don't know them, they're incredible people. So moving on to the next slide, which is business attraction. It's just really important that you understand that business attraction and retention are absolutely the key drivers of SLEP. And that links really well with the county because you have a growth pillar in your strategic vision statement. And it says we are striving for economic expansion and diversification. And that is exactly what SLEP is doing. In fact, SLEP's economic development officers are working with 78 leads and sale prospects and they have an interest for that have prospects or projects in Sarnia-Lambton. In fact, $3.9 billion in potential investment is tied to defined projects, and I think that's critical, in which Sarnia-Lambton has been shortlisted. In addition, local businesses are considering expansion that could impact our county by $93 million. That's growth. Next slide, please. On the next slide, you have a great example of a site that could attract significant development in the future, and I hear there's some great news potentially happening. In fact, mega sites like the one in St. Clair Township have great appeal to our industry. And SLEP has taken the initiative to work with a consultant on an investment attraction site analysis report. And I think it's going to be really valuable to people because it speaks to 18 sites for potential development. It gives insight to what might be needed to increase the economic investment potential. It allows municipalities, site owners, and SLEP to better hone their marketing appeal of the land, of their land. And so on the next slide with business attraction and outlook sectors, I just think it's really interesting to note that there is such a lot of attention and attraction to this sector, which is the focus on hybrid chemistry. And I want to thank the partners, BIC, Bioindustrial Innovation Canada, the college and the park for their work in these areas because it is obviously making a difference. We are making a difference. Of note, though, is the emerging low carbon hydrogen field and the resulting response by SLEP to develop and lead the Hydrogen Hub Working Group. Really timely and really important. It includes industry reps. Really, I can't tell you how important those industry reps are, and organizations that assist with startups, research groups, and the province. And now I am so pleased to announce that the Sarnia-Lambton Economic Partnership has been approved to receive matching funding from Global Affairs Canada to complete a low carbon hydrogen strategy. The strategy will guide the efforts by SLEP's led Ontario Hydrogen Hub, and we want to be that hub for Ontario by providing the framework and roadmap for the attraction of foreign direct investment while supporting the long-term success of Sarnia-Lambton and the low carbon economy. A great step forward in this drive. The strategy is going to align with the Canadian and Ontario strategies as well. And right after this presentation today, we are going to be releasing this information, but we wanted you to be the first to hear. And next on business attraction, we have another key sector, which is value-added agriculture. And that's in partnership with the Ontario Food Cluster and many, many other partners. We've developed many leads and prospects, and we've highlighted in the slide a couple of the agri-food investments anticipated to be announced this year in Sarnia-Lambton. So it's really beginning to be developed. In addition, on another sector, in the chemistry sector, the Diamond Petrochemicals Canada Corp purchase of the olefins facility from Arlanxio was finalized, which honestly is a real reason to celebrate because it's taken a while. And then if we moved on to the next one, which is the local partnerships and participation. You know, it's critical that SLEP must lead or have membership on key committees that represent a variety of sectors to develop networks and leads, of course, prospects. And of interest is the hybrid chemistry area again, the Carbon Capture and Sequestration Working Group, which hopes to change the legislation to enable the capture of carbon for our local industries. And that is critical in moving us ahead in that area. As well, we are hosting once again the Petrochem conference in June, which will really enhance the attraction of businesses into Sarnia-Lambton. I always think that when we can bring people in, show our beautiful county and our area, that is a real moment of success. And already the exhibitor space has been sold out. And the next slide, supporting local business. And under the same heading of retention of agricultural focused businesses and others, we are supporting 185 employers. A great example of this is not on your slide, but SLEP and its partners, of course, are supporting LCY on their nutraceutical expansion, which has the potential to create more than 10 jobs and over $1 million in investment. And again, our primary programs in 2021, I include the Lambton Agriculture Engagement and Support Program, the Digital Main Street, and Virtual Services Advisors. And all of that together has allowed us to support hundreds of local businesses and thousands of jobs across Sarnia-Lambton. And now, COVID. Once again, we heard Dr. Renata today, and now we talk about COVID again as well. So on the next slide, we have the COVID task force. Yeah, there we go. Sorry. The COVID task force, which is very active still. And what it's done, and I think the most important thing, is that it has linked businesses who are struggling with the supports that they need through the federal and provincial grants. So that's the key outcome there. And on the next slide, entrepreneurship. Entrepreneurship is the key mandate of the Business Enterprise Center that's located within SLEP. There was lots of interest this year, as you can well imagine, in virtual services at a time when perhaps people had lost their jobs or they were disillusioned. 50 entrepreneurs participated with the how-tos, and 8 moved on to start a new business. And finally, new resident attraction. And it is not last but least, this is critical to our area. In new residence attraction, we have been focusing on newcomers and bringing in people from large urban areas like Toronto, Ottawa, Guelph, etc., to increase our labor and workforce and attract entrepreneurs to Sarnia-Lambton. This is critical, obviously, and I think we need to talk about immigration as we go forward as well. And then piece of this is through the apprenticeship job match through the Skills Development Fund, which is working with the college and our large employers to attract skilled labor that is going to support the Sarnia-Lambton's core industry. We need people who have skills. And now to move on, that's what we've done. I hope you're excited by it. Now, 2022, what's going to happen next is to me really exciting. I have included here the 5 key sectors of SLEP. It's so easy to get expansive and to add more sectors and to lose focus, but these truly are our 5 sectors, and this is where we will concentrate. And then on the next slide, I'm going to hit every single point on the next slide, which I think are absolutely critical to what we're doing next. So to start, the low carbon hydrogen emerging sector that I spoke about before. I think we've made a great step forward with the funding for the hydrogen strategy report that is going to be announced soon, but stay tuned because there's more to come. And you heard about the emphasis on value-added agriculture. There are more and more partnerships being developed with key agricultural organizations and businesses. Well, it is going to grow. Pardon the pun. Sorry, low-hanging fruit there. We need to focus also time and energy on recovery. Oh, we're never going to get away from COVID. I'm fearful, but you know what? As we do that, we really need to help our local businesses. They need to be supported. We need to help in that recovery. And finally, we need to continue and drive collaboration throughout the municipalities. That is the only way we will be successful. We do absolutely need each other. And finally, because SLEP and its many partners are so critical to the economic prosperity of this area at a time when diversification has never been so critical, sustainability so important, and population growth so paramount, we need a higher profile, more focus on key areas and successes. So we will be developing a new marketing strategy to drive these initiatives and to attract foreign investment, job growth, and export sales. The future is looking bright. Thank you.
Thank you, Judy and Katherine. Are there any questions from council? Councillor Napper.
Thank you very much, Warden Marriott and Judith. We've got 2 or 3 really good off-ramps here from the 401. and I didn't see anything happening there. And I just looked down the road at Brantford and Cambridge there at the 24 highway, and they're just loaded with these fast food restaurants. And we have the land available there, but I don't. Are you working and doing anything on that? I know we've had a couple investors look at our plaza there at Reese's Corners in the last minute. I don't know what happened. The landlord got greedy or something. The deals fell through. But is there any approach to there? Because I think we're losing the market. Like Sarnia's got one there by Airport Road. We've got one. Watford's got one. And I just foresee a vision of those being filled with, Wendy's and Harvey's and all these stuff like other areas. And if only for the washrooms. There's no washroom between London and Sarnia. So can you maybe help us out what's happening there?
Thank you, Councillor Napper. You know what? I'm going to phone a friend here, and my friend is Matthew Sawinski, because I've been in the job about 30 seconds, and Matthew certainly has the backstory on this. So, Matthew, would you have an answer?
Thank you, Judy. Certainly, all of the prime investment land in proximity to the highway interchanges is of key importance, and certainly something that we do focus on. Making note that our primary focus will be on the sites that are actively known to be available and that we're actively able to market. So that would certainly include the sites around the Warwick Industrial Park, which is recently filled, but where there is additional land we know could accommodate additional investment. The ability to actively market in partnership with the City of Sarnia Economic Development Office, locations like the 402 Business Park, as well as privately owned land in proximity, such as the former Ube facility, which has land that is actively available. We recognize the importance of the transportation corridor associated with Highway 402 and recognize it as a key asset when it comes to development opportunities. So working with landowners, whether it be a municipality or a private landowner, is something that we're always actively doing, and certainly trying to put forward the investment opportunity, put forward the land to the suitable investment opportunities.
See, Councillor Ferguson had his hand up.
Thank you, Warden Marriott. I was quite pleased to see the collaboration with the Federation of Agriculture in Lambton County. In Ontario, agriculture is the largest economic driver. It is second largest in Lambton. As moving to the low carbon and the hydrogen, I think you see some more collaboration go in there with that. I was quite pleased to be involved with 2 of your videos, my family. And we've not had this before with the agriculture community collaboration. So just really I'm quite pleased with it, and I hope to see more and hope to see those. And for everybody, the videos are on the Lambton Federation of Agriculture YouTube page. They have a number of videos there, and I suggest everybody go and watch those. Thank you.
Thank you. Any other questions for the team? Seeing none. Thank you, Judy, Katherine, and Matthew. And that was a good, very good update.
Thank you. Thanks for the opportunity.
Our third delegation today is Mark Perrin, Executive Director of Tourism Sarnia-Lambton. He'll be speaking to County Council, providing an update regarding TSL's activities and plans. Welcome, Mark.
Morning, Warden Marriott and mayors, county councilors, county staff. Thank you for having Tourism Sarnia-Lambton on the agenda this morning. I'm pleased to have the opportunity to present and provide everyone with an update from our organization. In reviewing our mission statement and our vision statement, Tourism Sarnia-Lambton is the destination marketing and development organization whose objective is to serve Lambton County tourism assets and enhance economic growth and prosperity. With our vision statement, Tourism Sarnia-Lambton continues to be an industry leader supporting the vital contributions of our tourism industry into the local economies. Tourism Sarnia-Lambton uses our expertise to encourage all levels of the government to improve tourism-related infrastructure, and Tourism Sarnia-Lambton also encourages and facilitates leading-edge marketing and product development to enhance our tourism industry and our partners. In recapping 2021, Tourism Sarnia-Lambton continued capturing growth in all of our social media platforms. We created and launched a new mobile app. We integrated it with our partnership programs to extend our social media data collection. Throughout 2021, Tourism Sarnia-Lambton continued being a support pillar for hundreds of local business partners, as together we have navigated through the changes in COVID-19, helping explain the provincial stages, reopening plans, and restrictions, while sharing support programs and working through challenges while creating events, programming, marketing, and promotional campaigns to support all sectors within our tourism industry. Social media marketing continues to be one of the most effective resources as we grow our following and receive hundreds of thousands of page views annually. Facebook, in the spiking graphic below, shows us daily results from our 2021 campaigns that can be analyzed with all the marketing and promotional campaigns corresponding directly to the visitations and the success of our programs and initiatives. With Instagram, it's become quickly the main platform for reaching our 35 to 40 and under demographic, and with posts and stories boosting our engagement with hundreds of thousands of views each month. With Tourism Sarnia-Lambton, Lambton County is also now promoted on TikTok. TikTok is today's fastest growing social media platform, and sharing for short video content creates many more digital and social media partnership and advertising opportunities. In July of 2021, Tourism Sarnia-Lambton launched our Tour Ontario's Blue Coast app, which is available to be downloaded from Apple stores and on Google Play. The mobile app is integrated with Google Maps, and you can see and explore our tourism assets throughout Lambton County. The app is also a rewards program, as there are over 200 places throughout Lambton County inputted as destinations where users can collect points and then use those points, redeeming them for a gift card as part of our Discover Sarnia-Lambton gift card program. From July to December, 123,530 points were collected, meaning that there's just over 12,000 destinations that were visited, with visitors using our app to collect points to redeem the rewards. When looking at programming and events, Ontario's sport, tourism, culture industries have been among the first and hardest hit sectors by the COVID-19 pandemic. They are also expected to take the longest to recover. These are all highly touch sectors and depend on the gathering of people. In this pandemic, we've truly seen the significance of our tourism industry, which include all of our accommodation, restaurant, attractions, sports and events, and activity partners. Tourism continues to be a major economic driver within Sarnia-Lambton and for many of our small and medium-sized businesses depending on tourism, and it's evident the impact tourism creates for the health, well-being, and socialization within Lambton County. 2021 was a year of adapting, pivoting, and problem-solving. Our Discover Sarnia-Lambton gift card program has been one of the most successful tourism campaigns in Ontario and across Canada. Tourism Sarnia-Lambton has sold over $300,000 in gift cards that directly support over 300 tourism partners across Lambton County. The economic impact from this program alone is estimated north of $2 million. In highlighting our programs and campaigns, TSL partnered with the World Travel and Tourism Council and the Tourism Industry of Ontario for the Safe Travels program. With this, we signed up many businesses throughout Lambton County to join and display stickers and be part of all the health and protocols with the program to establish it as a safe parameter for people to visit. Our Support Local Restaurant Takeout Guide was one of the largest databases created in Lambton County and shared across social media, earning hundreds of thousands of views. Our Tourism Sarnia-Lambton also assisted with SWATC, the Southwestern Ontario Tourism Corporation, with the Tourism Adaptation Fund. This provided $240,000 to Lambton County businesses for business adaptations such as patios and more to outfit proper safety protocols for both spring, summer, and fall of 2021. Additionally, 4 of our main program campaigns for 2021 included Theodore Tugboat coming to Sarnia-Lambton last summer. The stats for each of these campaigns are located on the screen. seeing the reach from our Facebook, from our Instagram, and other social media platforms, and when the time periods they occurred. Another was the Ultimate Backyard Giveaway program, which focused on our drink producer sector, which has kept growing to now 15 partners across the county, soon to be 16, with the Point Edward Brewery opening up soon. This also includes our Wishful Adventure series. As we waited, we came up with plans on how to get people active and planning to visit Sarnia-Lambton when the time was right. And following up this past holiday season with our 12 days of Blue Coast giveaways, promoting over 100 businesses locally with different items where people could enter to win. In 2021, Tourism Sarnia-Lambton focused hard on media buys. Beginning in the summer and running into the fall, Tourism Sarnia-Lambton worked with media buys promoting our media buys throughout the province. We promoted our beaches and all of our destination assets through these media buys. Included on the screen are some of the campaigns with the Globe and Mail, Toronto Star, and we also had very strong social media marketing on this. Tourism Sarnia-Lambton continues to strengthen all of our partnerships, our meetings, our boards, our collection of information, our distributing of information, and listening to our industry partners on their needs while coming up with resources and solutions. TSL participates in bi-weekly Tourism Industry Association of Ontario calls, Southwestern Ontario Tourism Corporation meetings, Destination Ontario meetings, and a weekly Lambton County COVID-19 Business and Economic Task Force. We use these programs to continually assist and aid our industry partners with available government funds while providing what the latest health guidelines, safety measures are, and so much more. Overall, tourism has been one of the most active, engaging, and direct supporting organizations to assist our small and medium tourism industry business, not only in Lambton County, but within the province and the country. Tourism continues as a key economic driver in Ontario. Pre-COVID, the industry supported over 400,000 jobs, and in 2019 grew by $2 billion into an overall $36 billion industry in Ontario. Locally, the impact of tourism is north of $2 million annually, and we come in third, just behind London and Windsor, who we will be continuing to compete with those cities to attract more people from those areas into our own region. Tourism creates community prosperity as it attracts people to move here and become residents in our communities. It's one of the most important aspects for mental health and as a possible program or experience or event obviously makes people want to vacation, reside here, and talk about how beautiful our Sarnia-Lambton area is as they feel happy, refreshed, as we create overall community vibrancy. We're excited for 2022, and when the time is right, we look to continue welcoming visitors back to Lambton County. I'm just going to share.
Westbound on Highway 402, along Ontario's Blue Coast, your neighbors in Sarnia-Lambton have been waiting to invite you back. Waiting to share our stories, our passions, and our excitement. So, pack the car, the camera, and your sense of adventure, and visit us in Sarnia-Lambton. Explore something new, revisit something familiar. Reconnect with old friends and experience Sarnia-Lambton like never before. Welcome back to Sarnia-Lambton.
Thank you very much for the opportunity to speak to Council.
Thank you, Mark. Any questions from Council to Mark? Councillor Bird.
Thank you, Warden Marriott. Through the chair to our famous tourism representative, thank you very much for the presentation. You mentioned in there that you are, what you are doing to promote assets and activities within the county and in order to enhance the economic growth and prosperity. You've heard me say this before, but I want to come back to one specific asset activity, and that is the scenic flights at Huron Aviation. Can you please tell me specifically how that particular asset is being promoted so that people now know about it?
Yeah, I would have to probably double check with our social media, but I know we did do some coverage with Instagram on them this summer. We went out and shot some video as well with it, but it is on our website as well, promoted, and continues to be promoted on our website.
And thank you. Just one further comment, because in the material that you've shown us today in the presentation, I know it's very difficult to get a glance of everything that's here to people who are coming here for the first time and they don't know which direction to go in. And I appreciate all that. So I think signage for just a suggestion for the sightseeing flights, because after 42 years of living here, hardly anybody I speak to even knows we have these scenic flights. So I think if people come to Sarnia on business, and we're trying to attract more and more businesses and everything else, and maybe some of them only have a long weekend, just a couple of days, and maybe they only have an hour to spare between their business they're doing, there's nothing better than taking one of the scenic flights, because in just a half hour or an hour, you have a choice. They'll fly you in any direction that you choose, and you get an all-encompassing view of everything's here, or the resident side, the businesses, the scenery, the water. It's incredible. So is there any opportunity to put some signage up on the 402, 401, just pointing them in this direction?
Yeah, as far as the 402, 401, that's part of the TODS program with the government. So that would require most of businesses to look at their own signage from those. It is fairly costly on those. However, one thing that Tourism Sarnia-Lambton is doing is we are applying for a rural economic development grant, the grant application, and that will be based on a signage program for the county. What we've seen, and actually kind of replicating it from Huron County, is using county roads for signage, more signage on those, working with our local partners to have more directional and how many kilometers away different attractions are. So that is something we're looking for, some funding to have a person that can be dedicated to that task. It is reviewing kind of the overall strategy plan for tourism signage throughout the county, because we have quite a few different kind of past signage that really doesn't lead to. We have a tourist district that doesn't give a whole lot of definition on what that is in Sarnia and Point Edward. So it is something that's been on the radar. It's part of our new strategic plan that we're working on, and we're hopeful to get some funding to really dive in and have someone dedicated to that.
All right, thank you. Just one final comment, because I think with things like, and I'm using this example, and of course there are others, but this specifically because it's something that can give everybody a complete view of what the area is. But I think all of our signs for things like this need to be instant and obvious, because if people don't have much time and they're driving in or flying in, whatever they're doing, they don't want to have to refer to a book or a map or a digital program on their phone. Perhaps they don't have a phone. Perhaps they don't have any of these apps. So I think if with a focus on instant and obvious would really be a great help. So I'm pleased to hear that you do have some other programs and funding that you're following up on. So thank you.
Any other questions for Mark? Deputy Warden Hand, please. You're on mute.
Sorry. Thank you, Mark, for the presentation. And as I said previously, I'm impressed with the work that tourism was able to continue to do throughout the pandemic, because it was difficult, and yet there was some really great programs to continue to promote the area. One of the things I think we touched on recently, you and I, in a conversation, was around the videos, and recognizing that in a short video you can only do, you do snapshots of different pieces of the county. And you talked about more videos and other videos that are on the website. So I just wanted to, maybe you could touch on that so people know that there's more available to promote.
Yeah, absolutely. Thanks, Mayor Hand. with the videos, we actually have a 2022 campaign that we're started. The video that I showed today hasn't been released yet. We're waiting till the correct timing to obviously welcome more visitors back to Sarnia-Lambton. So we're planning this spring and hope to have that out kind of a March timeframe. But across the county, we are doing some filming. We're also updating our whole photo database. And really our plan with it, we want to do a 4-video series. This would be video 1, but really capturing footage from all across the county, especially in the heightened seasons for each municipality. So there's very unique offerings from each municipality, depending on what season it is. And we want to really focus on capturing that, and then not only using it for this years to come, but with it, we can then splice that video into different marketing campaigns on different platforms. So, for example, the video you saw today is the 1 minute Ontario version. We also have a 1 minute US version that's available, and then we have that trimmed down to I think 4 different 30-second videos that can be used more on social media platforms and so on. So lots of different kind of marketing tactics we can do with the content, and we're looking to update those databases, especially the photo, create more diversity, and then that goes along with our video too, just showing more cultures, more diversity throughout Sarnia-Lambton, and using that to reach the GTA and greater markets that way. So definitely a great initiative.
Okay. Any last questions for Mark today? Seeing none, thank you, Mark, for your presentation. Good update.
Thank you, Warden Marriott.
Back to the agenda, item number 9, minutes of open session council of November 24th, 2021. Do we have a motion to adopt those? Councillor Weaver, seconded by Councillor White. All in favor? That's carried. Brings us to number 10, the annual general meeting of the County of Lambton Community Development Corporation. And if you refer to your agenda for that, the first item is appointment of chair. Mayor Bradley is the actual chair of CLCDC. How do you wish to, Mayor Bradley?
Yes, Mr. Warden, as the standard practice, I would move that you be the chair of this public session.
Okay, do we have a seconder for that? Councillor Weaver seconds. All in favor? That is carried. Thank you. Number 2 is introduction of members present. Mr. Tifo, do you have that handy? Sure, please.
Thank you, Warden Merritt. Of course, the members, the directors of the board for CLCDC are, of course, Mayor Bradley, Mr. Rob Cardis from the college, Lisa Chiquetto, Tom Streifler, Miriam Capetz, Allison Ewert, and of course our Deputy Warden and Warden Merritt. So
thank you, Mr. Tifo. Approval of the agenda. Do we have a mover and a seconder for that, please? Councillor Bradley moves and Councillor Cook seconds. All in favor? That's carried. And any declarations of pecuniary interest? Seeing none, moves us to presentation of financial statements. Is Mr. Pilarchio available, please?
Thank you through the chair. Just happy to present the financial statements on behalf of the County Lambton Development Corporation. The financial statements reflect the financial position, the results of operations, the changes in net debt, as well as the cash flows for the corporation. BDO conducted an audit, and basically, I'm happy to announce that we have an unqualified opinion, and the statements are presented fairly for County Council to review. Happy to respond to any questions that the county may have on this matter.
Okay, I see a question, Councillor Stark.
Thank you, Warden, and this is to Mr. Pilarchio. If I turn to page 5 of the financials as presented, I'm looking at the net deficit for April 30th, 2021, with a projected deficit of $567 and a budgeted deficit of $483,000. I recognize that we are in a period of COVID and have been for the last 2 years. I recognize that the County of Lambton has made some significant alterations to the funding arrangement. My question is, do we have any idea or projection as to when this deficit will be turned around? That's the first question. The second question relates to the financial statement note number 9, which deals with budgets. And the concerning part for me, and this may be not a position that you can answer, however, if I just read the note, and I believe it's in the B, in section B, at any rate, what it talks about is that your budgeting process does not follow generally accepted accounting principles. And I wondered why that was in terms of an accrual basis. I wondered why that was, and does that have any implication to the County of Lambton as it relates to risk exposure?
So through the chair, thank you for the question, appreciate it. The first question, which basically related to the shortfall or the potential deficit and the areas of potential improvement over, that's a difficult question to answer given our COVID environment, but I can tell you that based on the meetings that I've been sitting through, we do anticipate some better revenue projections in the future period, which will hopefully offset some of that projected shortfall. So we're hoping to see the light at the end of the tunnel. As far as the second question, and as far as generally accepted accounting principles and so forth, it's important to note that from a budgetary process, the budgetary process follows management accounting practices, and we try to present the financial information in the best way possible. Sometimes that doesn't coincide with the way financial statements are presented, so you may see some differences in presentation there, and I think that's one of the reasons for the note. But as I've stated before, the financial statements are prepared fairly, and we did receive an unqualified opinion on that.
Thank you.
Any other questions? Seeing none, then we move to an update from Katherine Albion, the Park Executive Director. Welcome, Katherine.
Thank you, Warden Marriott, and good morning, Council. I am very pleased to share the Research Parks update with you today. This morning, I will provide you with an overview of the park's increased utilization and value of our assets, our research and commercialization activities, and the impact of the park and our tenants on the local community. The Western Research Parks have a history of success and international recognition based on our support of Research and Commercialization Center tenants, our tenants' economic impact on the region, and their success rates following their graduation from the park. 2020 and 2021 were challenging years for all businesses, and the park has continued to fare well respectively to date. Throughout the pandemic, the park has provided unwavering support to our Commercialization Center tenants to assist these growing organizations overcome new challenges to continue to achieve their technology and business development ambitions. The park's current real estate occupancy is 81%, with a mix of anchor tenants and startup companies. At the onset of the pandemic, one of our anchor tenants downsized, and 4 leases ended due to the pandemic, which decreased our occupancy to 74%. Since that time, we've steadily grown our occupancy, with the majority of our new tenants establishing in our Commercialization Center. We use the year 2012 as our reference point, since we struggled at this time due to the loss of large anchor tenants, which dropped our occupancy below 50%. Although we have commercial office suites available for lease, we remain in a strong financial position. We continue to develop new tools to attract innovative companies, which will help drive economic growth in the region to establish at the Research Park. Following financial restructurings, our financial projections are in a stronger position. Our energy savings programs and refinancing of recent years has resulted in a cost savings nearly $1 million to date. Our Commercialization Center is the nucleus of research and development at the Research Park. We've experienced strong growth of our research and commercialization activities in recent years. Throughout 2020 and 2021, we welcomed a number of new tenants to our Commercialization Center, and we continue to see strong leasing demand for all of our various incubation suites. We have a range of tenants conducting research in our labs, including applied research centers, university spin-offs, and startup companies. Our research labs are occupied with students, researchers, engineers, and technologists, conducting research projects for local clients, supporting our local industries, as well as advancing emerging industrial sectors. We are also home to a number of pilot plant tenants at various stages of the commercialization process. Our pilot plant is 75% leased, and we are collaborating with a number of organizations regarding their potential use of our remaining space to scale up their new technologies. The majority of our pilot tenants are technology startups from outside of Sarnia-Lambton, with plans to expand their operations in the region. There is a strong and growing demand for lab and research space throughout North America, and this is a trend that we are also experiencing in Sarnia-Lambton. The park labs are at capacity, and we continue to receive new inquiries for labs for the implementation of new research projects in emerging economic sectors aligned with our strategic plan. The park is exploring options to expand our research and lab capabilities so that we can continue to attract new companies to our Commercialization Center and further drive the region's economic growth and diversification. Our key academic partners continue to be Lambton College and Western Engineering. We have hosted their research centers, partnered on key events, and support the initiatives of both institutions. We continue to strengthen our relationships with both institutes to further support our clients and advance technology development in Sarnia-Lambton. Over the last year, the park also strengthened our relationships and collaborations with Western University and the London campuses of the Western Research Parks. In September, our Sarnia-Lambton Park hosted a visit for Western University's president and members of the university's executive leadership team. We shared an overview of our park's growth of technology and innovation-based tenants and discussed opportunities to strengthen the relationship between the park, region, and university. Our affiliation agreement was also renewed with the Western Research Parks. In addition to the new initiatives of the past year, the Sarnia-Lambton Park will collaborate with the London campuses on joint strategic planning, promotion of all 3 park campuses, and opportunity development to accelerate the growth and sustainability of businesses in southwestern Ontario. The park is very fortunate to have strong partnerships to advance our operations and our tenants' needs, and we also contribute to our partners' initiatives. The park contributes to various community development, education and training, technology incubation, and emerging economic sector development projects. Our partners have similar mandates, and we all play unique and important roles in the economic development of the region. The park has successfully completed the first year of our 5-year strategic plan. Our strategic plan enhances the role of the Research Park in the economic development of Sarnia-Lambton and is a world-class technology incubator of the region. We saw the most growth within our Commercialization Center, and we are exploring opportunities to meet the strong demand for commercialization infrastructure. We've obtained funding and are completing projects to enhance accessibility at the research park. A specialized extrusion research center was established, and along with our partners, we continue to investigate the establishment of new innovation centers at the park. The park also built new relationships to provide new resources and support networks to our startup companies and entrepreneurs. Overall, we are strongly fulfilling our mission to enable and catalyze economic growth, innovation, employment, and wealth creation through our Commercialization Center. 2020 and 2021 were challenging years. However, the research park continues to experience promising growth. Last year, we welcomed 8 new companies to the park and 16 tenant leases were renewed. We're extremely proud of our Commercialization Center tenant successes and their growth at the park, which has resulted in significant job creation and extraordinary investments in their company to accelerate the commercialization of their technologies. The park and our tenants are creating local, national, and international impacts. The park is succeeding to attract new companies in emerging economic sectors, and our tenants are establishing, expanding, and creating new opportunities in Sarnia-Lambton. Currently, our occupancy rate is growing at 81% with more than 50 tenants. In 2021, our tenants received significant investments in their growing companies to launch them to the commercial scale. We have become the preferred location for innovative companies to establish and grow. Our tenants have become established in Sarnia-Lambton with plans for further growth in our region. We are fulfilling the park's mission and vision of supporting economic growth and development. Research, commercialization, and entrepreneurship are at the heart of the research park's mandate. We are driving innovation in the region, which is proven by the continued growing demand for our research and commercialization facilities and resources. Our strong partnerships and initiatives continue to result in new tenants at the park and growth for Sarnia-Lambton. Thank you.
Thank you, Katherine. Are there any questions for Katherine this morning on our update? Councillor Stark.
Thank you, Warden. This is really a follow-up, Dr. Albion, to the question that I asked Mr. Palarchio, and that is relative to the ongoing operations. I recognize, first of all, that our intention is not for you or for your organization to make money, but we do want to try and get to a break-even point. So my question is, with respect to your real estate occupancy, currently at 81%, is there a break-even? Is there a occupancy percentage that would allow you to break even? And how close to that are we, or is that attainable?
Yes, we have calculated our break-even point, and one of the aspects of our deficit is our long-term mortgage we have for the 1050 building. When the 1050 building was constructed, that provided with a long-term debt, which we are gradually paying down. And the term of that debt is currently at 19 years from this current date and time. So at that point, we are providing our required interest and principal payments towards that debt. But it is an additional burden on the research park's financials.
But I recognize that. But the county we didn't forgive, but we converted debt previously. Are you suggesting that there's going to be another requirement like that, or where are we? I'm trying to get to the answer of at what point are we going to be at break even?
Yes, and we do have our large commercial suites are vacant, so we do have new tools in place to help us find new tenants, preferably from outside the region, to bring more investments into the park. We do have our depreciation, so it's a lot of these non-cash expenses that are contributing to our financial deficits. In terms of strictly cash operations, we are meeting our expenses. It's the non-cash deficits that that do result in our current financial position.
Thank you. The whole concept of depreciation really is recognizing that even though it's a non-cash, it recognizes that there will be a replacement of assets in the future required. So while it's a non-cash expense, it does represent a future expense that will have to be incurred. So I do have some concerns.
Any other questions for Katherine this morning? Councillor Boucher. You're on mute, Councillor Boucher. You're still on mute, Councillor Boucher.
Okay. Can you hear me now?
We can.
Okay, thank you. Some time ago, I was a member of the organization, and those days we had tremendous active cooperation with Western University. We had visits, we had all kinds of cooperation, active cooperation. Could you describe to me now what is the cooperation between you and the visits and Western University, and what benefits do you have?
Yes, over the past year, we have significantly increased our relationships and collaborations with Western. We continue to host their research events, so we are starting to plan for our capstone event. Due to pandemic restrictions, it will be virtual this year, which will be the second time that the competition has been hosted, so we will not have the students on our campus next month. So we continue to support the research competitions for Western. We have some of their startup companies located at the park. We've got specifically a researcher from their medical school, professor emeritus from their medical school, developing natural health products from locally sourced agricultural biomass located at the research park. And we have strengthened our relationships with the park campuses. I've been working with the teams in London since last spring to develop new programs that can bring additional resources from London to our park, and as well as share our resources with them. So with these additional opportunities, there are enhanced sharing of best practices, additional resources to support all of our tenants within the 3 campuses of the research parks, and additional experience from researchers. We're also looking at developing programs such as a liaison program where our tenants can tie into some of the resources and researchers at Western. And we're also looking at joining a new consortium at Western that's focused on bioproducts and bioproduct development. So there's a number of new collaborations underway that we can bring in the expertise and resources from Western to support our tenants and clients here in Sarnia-Lambton.
Thank you very much, and I think you're doing a good job.
Thank you very much.
Councillor Bradley.
Avalon is being too modest. Western lost its director of the Western Research Park in London and went on to another opportunity. And Western asked us if we would lend Katherine to Western. And I think it's been about 6 months now. So she's been running 2 research parks. That's how strong the relationship is. And that's quite an achievement. You know, that we're running the park in London also because of her skills. And she's too modest to mention that.
Thank you.
Thank you. Any other questions before we let Katherine go here? Seeing none. Next on the agenda is item number 7, confirmation of officers and directors. Refer to page 83 of your council package. Number 1 is positions for the board. Do we have a mover and a seconder? Moved by Councillor Weber, seconded by Councillor White. All in favor? That would be carried. And number 2 is the positions of secretary and treasurer. Do we have a mover and a seconder for that? Councillor Miller and Councillor Napper. All in favor? That's carried. And that brings us to appointment of auditors for 2022. I would suggest that we have BDO for 2022. That's moved by Councillor Broad, seconded by Councillor Bean. All in favor? That's carried. Is there any other business? Sorry, just sorry, we're just informed that we need a motion to confirm the financial statements. Who would like to move that? Councillor Cook, seconded by Councillor White. All in favor? That's carried. Thanks. So that was back to other business. Is there any other business for CLCDC? Seeing none, I would take a motion for adjournment. Moved by Councillor Bushy, seconded by Councillor Weaver. All in favor? That's carried. Thank you.
Thank you.
Thanks again, Catherine. That moves us to item number 11, correspondence. We have 2 items for correspondence from member municipalities. Do we have a motion to receive and file? Moved by Councillor Bradley and seconded by Councillor Weaver.
No, actually, Mr. Warden,
you'd like to split them up?
Yeah, and I was going to move both of them. I mean,
yeah, that's what I thought we were doing here.
Okay, well, I'll move the first one and leave the other one for Mayor Napper.
Okay, you move. So Councillor Bradley moves the first one. That was seconded by Councillor Weaver. Yeah. All in favor? That's carried. And Councillor Napper, you moved the second one?
Yes, our people thought we should be supporting this. It's something that needs to be looked at here, and it's a safety thing, and I would certainly get your support to support this.
Okay, thank you. We have a seconder for that. Councillor Bird, all in favor? That's carried. And moving on to number 12, information reports. First, this one is under social services. The motion to receive and file that. Councillor Bradley?
Yeah, I would move to receive and file it with the comment that I've raised this issue, and I appreciate the very tight time frame. I appreciate the dialogue and the information that went on, and it's a helpful report for us to have in the future.
Okay, thank you. That was seconded by Councillor White. All in favor? That's carried. Yeah, Councillor Brumboats.
Thank you. I just had a question about the report. It's a great report, very helpful, but I'm wondering, are there incentives in place either through the county or the province or the federal government to incentivize and encourage builders to focus on more affordable housing? Like if you're a builder in a community, you want to make the biggest bang for your buck, and they seem to be building these really big, expensive houses that are in the $300,000, $400,000, $500,000 range, and it really prices a lot of people out of the market. Can social services tell us if there is any kind of programs like that, or maybe that's something I don't want to put you on the spot right now, Ms. Calasanti, but like I would love to know if there is programs so that we can suggest that to some of our builders in our community that are coming forward.
Certainly through you, Ward Marriott, to Councillor Romboats. There are a variety of different subsidies and things available, but they ebb and flow. So what happens often is the province will make an announcement or will receive some funding, and then you'll see the counties doing an RFP for an affordable build. I think that there are some programs through the federal government, and often we speak to developers and we can talk to them about these co-investment funds and other funds that are out there. The county is, you might recall, I believe it was October's council meeting that they did approve the development of an affordable housing reserve, and you will see that coming up in the budget. We have to make some policies around how that would be used if we do get that reserve. So there's that coming. And in November, we provided a workshop for lower tier municipalities about what they could do to assist with affordable developments in their own communities. And certainly that information is available through our office if you'd like us to reshare that. Things like waiving development charges or other things can happen at the lower tier. They can sort of enforce that a certain percentage of new builds be affordable. So there are some things that can happen. It really is up to the lower tier to take a look at those as well.
Thank you very much.
Councillor Napper.
Yeah, just to follow up on Mayor Rumbold's thing there, in fact, I was going to ask a question. I slipped my mind here. There used to be a policy out there where people come in and builders, and if they built, they got a grant through us. Is that still available? I remember there was a different place come in. They had to keep so much percentage and stuff like that. Is that program still available?
Through you, Ward Marriott, to Councillor Napper. I'm not familiar with that particular program. My apologies. So I don't think it is still available. But again, the policies are changing consistently with the province and with the federal government. So we try to get information out as soon as we're aware of any new programs.
Maybe, if I could, maybe I wasn't making myself clear. I think what it was that there was a plan in place and the developer could come in and we would support them, and they had to keep, I think that was for more low cost housing. They built a project, we would fund them. And I thought there was one in Petroleum, just had that funding perhaps, but okay.
Just as a follow-up, you're right. Sometimes we do receive funding and the county will do an RFP for private sector to come in and build affordable housing. And we've built quite a few units over the last 8 years. But again, the funding isn't automatic. It really just depends, different programs that come from the province, and then we're able to do an RFP for that funding. We don't have any available at this time.
Councillor Arnold.
Thank you very much, Ward Marriott. Just a couple of comments. One, I was quite surprised when there's only approximately 90 people that are homeless that were recognized in this report. I'm not sure if there's more or if there's less, but I was surprised at the number. And the other piece, I've done watching all the conveyances that have taken place in my municipality. Very few single-family homes are being sold for less than $300,000. And when you start looking at, and that's not a fancy house. That's a lot of those they're all existing houses, because you don't build a house for $300,000 in Lambton County anymore that I know of. And when you start looking at that, and they talk about 30% of your wages go to your housing, that would mean that you would have to make somewhere around $4,500 a month. And we're looking at different businesses and industries around, and for someone to make $4,500 a month is a high wage in this community, and I don't know how anybody can move forward in the state it is presently. So I understand all the stuff that was studied. I appreciated all the work that was done there, because I think it really highlights the needs that all of us that are looking out for those in our communities, we have to keep moving forward with initiatives that we can have smaller housing footprints and things that are more necessary for people just to survive. Because right now, many people cannot survive on the way the housing is. So I appreciated the work that's been done here today that we've had a chance to review.
Thank you for that, Councillor Arnold. Councillor Napper.
Yeah, just to follow up on that, I heard the real estate board the other day say that it's impossible to buy a house under $350,000. That the flippers are coming in and buying them, and then all of a sudden they're $500,000 homes. So they said the market is really low on that. And I know in our municipality, if somebody comes up for $125,000, they're lined up there to come in, and they'll get $200,000 or $300,000 for it. It's incredible. I don't know how people are going to buy a house.
Okay. Councillor Bradley, did you have a question?
No, that's fine.
Okay. Any other questions or comments before we move on? No. Okay. That brings us to item number 13, items not requiring a motion. We have 2 of them. Motion to receive and file those. Councillor Miller, seconded by Councillor White. Sorry, Councillor Loosely, seconded that. All in favor? That's carried. There are no reports requiring a motion at this time. That brings us to item number 15, committee minutes. I call on Councillor Arnold, please.
Well, thank you very much, Ward Marriott, members of County Council. It is indeed my honor and privilege to be able to present the committee 9 o'clock meeting minutes on January 19th for Council's consideration.
Thank you. Number 1 and 2 is the election of Councillor Arnold as chair. Number 3 was, number 2, appointment of vice chair was included in that, and that was Councillor Stark. And number 3 was the appointment to the County of Lambton Agricultural Advisory Committee. And I believe that was, who was that? Broad. Councillor Broad, that's correct. Thank you. Number 4 was Infrastructure and Development Services. Reports requiring a motion. Number 5 was a report from County Road 7, parking restrictions. Number 6 was a report from the road widening dedications on County Road 26. Number 7 was a report regarding the road widening dedications along various county roads. Number 8 was correspondence to be received and filed. Number 9, information reports. Number 10, under emergency medical services, information reports. And number 11, under cultural services division, information reports. Number 12 was report requiring a motion. The overdue library materials. And number 3 was a report regarding removing fines from overdue library materials. And number 14 was adjournment. Councillor Arnold, please.
Thank you, Ward Marriott. I move this day's minutes.
Thank you. Seconded by Councillor Weaver. All in favor? Let's carry. And I would call on Councillor Ferguson, please, for the PM committee.
Thank you, Ward Marriott. It's also my privilege for the first time to present the minutes for the PM committee to the rest of council. Thank you.
Thank you. Number 1 was the election of councillors. Number 6, under corporate services, report requiring a motion under services and fees schedules. Number 7, under finance. Sorry, go ahead. Go ahead, Councillor Leslie.
Yeah, thank you, Ward Marriott. It's just wanted to back you up in regards to item number 6.
Sure.
The services and fee schedule. Is it customary, or did we do any advance notice on these increased rates?
I'll refer that to Mr. Tifo, please.
Yeah, the county's practice is to provide this as part of the agenda for your committees, which are public agendas. And at that point in time, that would constitute sort of the advance notice for most of the increases that are in the 2022 revisions. And of course, it's published again as part of the council agenda, and that would be the notices. But for the most part, that's the notice that you may be speaking about in terms of public notice for these increases.
Okay. And back to number
Ward Marriott, can I?
Yeah, go ahead.
Just to respond to that, I guess the only concern I've got is by putting the bylaw through effective today, even though I know it's been on the agenda, when you've got some substantial increases, especially in the planning department, of somewhere to approximately $500. So someone could come in today or tomorrow and you say, you know what, we need $500 more. My concern is I would have felt better to give some advance notice or put it into effect in a couple of weeks or next month rather than putting it into effect immediately. And it's and I would feel comfortable if we had to give a little more notice. That's all, Mr. Ward Marriott.
Thank you. take that as, I'm sure staff will take that down. So it brings us back under Finance, Facilities, and Court Services Division as an information report regarding the Bayside Center Activity Report. Number 8, Social Services information report regarding Maxwell Park Place affordable housing. Number 9, 10, 11, and 12 was in camera. And 13 was adjournment. Councillor Ferguson.
Thank you, Warden Merritt. I'd like to make a motion that these minutes be accepted by council. Looking for a seconder, please.
Seconded by Councillor Miller. All in favor? That's carried. Thank you. No items tabled from previous meetings. Brings us to 17, notice of motion. Councillor White.
Thank you, Warden Marriott. As per the email that was sent out regarding the delay in the Ogre conference, I move that we revert the budget meeting originally scheduled for the Wednesday that was subsequently changed to the Thursday back to the Wednesday, March the 2nd, please.
Okay, do we have a seconder for that? Councillor Weber. All in favor? Opposed? That would be carried. Thank you.
Mr. Warden, can I just ask? If one place says the second, other place, did you not just say the third?
It was changed to the 3rd. We're moving it back to the 2nd.
Thank you.
So we're back to the normal time of the first Wednesday. Councillor Rumbouts?
Yes, there was some question at some point about when the delegation requests are for OGRA now. I'm wondering if staff has the answer to that.
Mr. Cole, could you answer that, please?
I can, through you, Mr. Warden, to Councillor Rombouts. Please stand by. I believe that's, oh, here we go. March 8th is the new delegation submission deadline.
Thank you. I had heard it had been extended because of the move of the meeting, and I knew some of the other councillors were interested in maybe discussing possible delegation requests. So thank you.
Thanks for clarifying that. That brings us to number 18, other business. Councillor White.
Thank you, Warden Marriott. I'd like to just serve notice of motion for the next regular meeting of County Council for 2 motions that I will be forwarding to everybody ahead of time. One in regards to a climate change adaptation and mitigation strategy for the county, and also one in regards to the predatory practice of real estate industry professionals providing below market value pricing for vulnerable residents for their properties, and then turning around and flipping the properties for a profit. So more of just an advocacy piece on that one, but it was raised by a member of our county with me, and I'll just be bringing forward a motion to speak to that. Thank you.
Thank you. Deputy Warden Hand, you had your hand up?
I just had a question to go back to Councillor Loosely's comments around the timing for the increase, and you suggested it would go back to staff. I would just like to know when that would be if we were going to publicize that within our own municipality. So do we think it's later, or is it now? I need some understanding of what's happening with that request.
My understanding, Deputy Warden, was that that would be something we'd look at for next year. Is that not correct? I believe it's past that it's effective today, so anything change would be considered for next year.
Thank you. I misunderstood.
Anything else under other business? Saying none, that takes us to notice of bylaws, item number 19. Mr. Tifo, please.
Thank you, Warden Merritt. It's moved by Deputy Warden Hand, seconded by Councillor Bean, that bylaws 1, 2, 3, 4, 5 of 2022 as circulated be taken as read a first and second time.
All in favor? Opposed? That's carried.
It is moved by Councillor Bean, seconded by Deputy Warden Hand, that bylaws 1, 2, 3, 4, and 5 of 2022 as circulated be taken as read a third and final time.
All in favor? Opposed? That's carried. Wow. Councillor Napper, were you opposing that?
I sure was. I'm on a fixed income.
Okay, duly noted. And that brings us to adjournment. The next meeting would be the new date that was passed, Wednesday, March the 2nd. Do we have a motion to adjourn? Deputy Warden Hand, Councillor Bean seconds. All in favor? That's carried. Thank you very much, Council. Have a good, safe trip home with the snow that's happening. It's getting pretty messy out there. But I think most of you are home anyway.
Thank you.